Thank you, the organizers, for inviting me. I'm sorry I cannot speak Chinese, but the presentation is in Chinese, so I hope that I can walk you through an interesting story concerning the plasticity of the visual system and vision restoration, and especially what it has to do with a more holistic view of losing vision and regaining vision again, based on the ancient techniques and also on modern neuroscience techniques. So I think that the combination of modern thinking, of looking for mechanisms of action, and at the same time valuing and using old traditional techniques, it's an interesting opportunity. So as we have the next slide, can you? Oh yeah, okay. So the way we look at visual fields traditionally is that we think there is an area that is normal and then there is an area that is blind. So it's a black and white view of the visual system. But in reality, we know from visual fields that there are areas which are gray. They are neither blind nor are they normal. And we call these areas of residual vision or of relative vision. And this is the target of the research we do, trying to improve vision by targeting these partially damaged gray areas and help them to improve. And if I ask you, when do you go to the hospital? Do you go to the hospital when you are healthy? No. Do you go to the hospital when you are dead? No. You go to the hospital when you are sick. And what we are proposing is that in visual disorders, there are sick cells which are in a hypometabolic state, too healthy to die, but not healthy enough to function. You see them every day, and yet we have not thought about enough of these areas and how to improve them. So one opportunity to improve residual vision is to look at patients not only at the eye, but to look also at the brain and the rest of the body. Organs like the eye or the brain can never be viewed alone, but they always work together in a system of the whole body, and therefore ignoring the body or not thinking about the body will limit our view on understanding vision loss, and it also limits our ability to find ways to improve the vision. So if we ask how much nervous tissue does the eye have or the brain have, the answer is the amount of tissue in the retina of nervous system tissue is 1 gram. But the amount of tissue in the brain which processes visual stimuli is a several hundred gram. So what I propose to you, let us not only focus on the retina, but let's also understand how the brain is involved in visual processing and what we can learn from the brain, why vision problems happen and how they can be fixed. So with the next slide here, you see that the brain supports many, many different functions, all of which determine if you can see something and interpret it properly. Let's use a simple test, perimetry. In perimetry, you present a dot, just a short dot, and you have to press the button. What does it take for you to press the button on time? It takes sensory elements, of course, of the retina, that the retina is able to process the information, and the physical conditions of the stimulus have to be correct. But it mostly depends also on brain processes, such as attention, global attention, local attention. It depends on fatigue. How tired are you? How much stress do you have? What is your emotional state? If you're afraid, oh, I won't see the dot, then you miss it, because the nervousness makes you miss the dot, the small dot, which is difficult to find, right? So all of that has an influence. Expectation. What do I expect? Do I expect a dot or do I expect an elephant? That is a totally different reaction if you press the button or not. Time of day and also fluctuations in the brain physiological state, which can be measured by the EEG. These are all acute influences. And there are chronic influences. Chronic influences of the brain are the degenerative state, for example, of the visual centers, like visual cortex, the lateral geniculate nucleus, which also degenerate, for example, in glaucoma. So even though we know glaucoma as a disease of the eye, it really is a disease of the eye and the brain. The memories that you remember to press the button. Yeah, you may not press the button because you forgot, oh, I forget to press the button, because you may have dementia or Alzheimer's disease. So then they think you have no vision, but you have vision, but you just didn't remember to press the button. And chronic stress. And so I'm trying to argue that we should not forget about the brain, but we should pay more attention to it. So is vision loss an eye problem, or is it a brain problem? In order to get a full understanding of the brain and all the influences, there are different fields which are contributing to our understanding of vision loss, such as pharmacology, neuroscience, neurology, psychology, rehabilitation medicine, and even traditional medicine, like traditional Chinese medicine or Indian medicine, or even traditional European medicines. So moving on to the next slide, we can understand then that we need to take a look at vision loss and the recovery of vision loss as a holistic problem. We cannot reduce it to single molecules, but we need to look at the body as a whole. Only then can we expect to fully understand vision loss and its consequences and finding ways of how to improve it. So to make it even more complicated, and I'm not going through all of this, there is an interesting interaction between these different organs, which these slides illustrate. So we have the eye that sends information to the brain, but the brain influences whether or not you see something, for example, because of your attention. You pay no attention, you don't press the button. But the brain itself is then also influenced by the vascularity. How well is the brain vascularized and how well is the blood flow functioning, which influences brain functions. And at the same time, the brain influences, via the release of stress hormones, how the vascularity system works, which then in turn also has an interaction with the eye. So you see, it all hangs together. And I call this the brain-eye vascular triad. It is a holistic yet modern approach of looking at vision loss from a more integrated, global and holistic point of view. The next slide shows you now a bit more about the brain. So I'm a brain scientist, and by training I'm a psychologist. So therefore I am allowed, quote unquote, to think in very broad terms. The way that we study nowadays the brain in my lab is by looking at the network, how the brain processes information in its network. And you should understand that brain function is a matter of neuronal activity that works in synchronizing circuits. So we have a lot of different circuits in our brain that all function together, or should function together, to provide the basis for our ability to see things. On the upper graph, you see W1 and W2. These are sinus waves, very simplified version. Yeah? So two waves or two synchronies of different circuits, they can be either synchronized or non-synchronized. Yeah? To illustrate what I mean by that, could I ask you to please clap your hands as if I am finished with my lecture? Could you all clap your hands? Okay, great. Now imagine you're in a concert, okay? and I was on stage and you really love my music and you want me to come back, what do? You all clap together. Let's try that. Okay, very well. So what do you see from that? It's the same activity, but the timing is different. Yeah? So now with the clapping hands all together, you have a synchronized pulse. But the brain may function in synchrony or not in synchrony. So it could be all random or it could be organized and synchronized. Same activity, but different timing. So in a way, timing is everything. So if you look now at the lower graph, so the upper graph, you see how the two waves on the left, they're against each other. So the result, the sum of it is 0. Whereas if they're synchronized, so that the amplitude, the peak is at the same time, the sum of the same activity, the sum of it is very different. So it could make a difference how the brain synchronization works if you see a stimulus or you do not see the stimulus. It could be the same activity. It's just a problem with the timing. Yeah? So now looking from the brain perspective, on the lower graph, you see on the left side, the brain, where all the waves are kind of not in organization. And when you have a retinal signal, which is then amplified by the brain, actually is not amplified because the brain is unsynchronized. And the sum of it, which is on the top, the vision, actually is not sufficient for you to see something. But the same activity on the right side, the retina has the same activity, but the brain is synchronized. You see that the brain circuits are all in proper order, maybe also because the blood flow is functioning well, besides the physiology. Then you could get a signal that you see consciously. You can see actually a visual percept. Now, we try to induce such a synchrony by applying electrical stimulation to the eyes with these electrodes that are positioned there. This is the machine. And you can see where the current flows. So the current flows to the eye, which is up on the right, but it also flows to the brain, to the frontal cortex, which has very important functions as well. By delivering the pulses in a certain frequency, so a synchronized pulse, you can improve vision. And this is what I want to show you. The next slide shows upward. You see brain activity before a patient that suffers vision loss shows no alpha or very little alpha activity in the brain. After 5 days, you have some emerging alpha, and after 10 days, you have much more alpha activity, which is important for vision, which is beneficial for brain networks, because you see on the left, this is a normal connectivity of a patient. In the middle, after optic nerve, and on the right, after treatment of 10 days with alternating current stimulation. The next slide shows that this has also an effect on oxygenation in the brain. This is a stroke patient who suffers hemianopia, and you can see here little oxygenation, a lot of oxygenation. Yeah? So the current apparently does something to the brain that improves the function of the brain. Okay, here you see a visual field of an optic nerve patient. Black is blind and gray or white is seeing. This was before the therapy. And the next, can we advance the next slide? So Ing, could we please move on? Thank you. This is after therapy. So if you go back and forth, Ing, if you could go back and forth. If you go back and forth. Before therapy, after therapy. So if you leave this black one, the dark one for a minute, just go back once. If we look at that, and the patient comes with this visual field, you say, sorry, you are blind, it will never change. But what we are saying is there is a potential of vision behind the black curtain, next slide, which is proven by the fact that the same patient 10 days later has this vision, so significantly improved. The next slide shows the results of a clinical trial. So we conducted a multi-center trial in Germany. Back in 2016 it was published, and you see that the average improvement is 24% visual field gain in the total visual field. And if you just look at the blind or black region, the significant change is in the order of about 60%. So the next slide we see the results of our therapy in Magdeburg that looked at a clinical population of 600 patients. This is the distribution up there. You can see the change over baseline as a function of age. So age makes no difference, but you get a huge variability in response. Some patients have tremendous improvements, which are the ones on the right, but not all of them. The majority of them have intermediate improvements and some have no improvements. That you also see on the bottom. This is a visual function as a change over baseline in terms of visual field size. So the improvement is not dependent on age. The vision restoration is not dependent on the visual field size, but it must be dependent on something else that we still need to study. And the next slide shows this again. On the left, the treatable diseases. What is the effect size? And there is no side effect of the electrical stimulation. So there is a chance to improve vision without a risk, and I think that's very good. And these changes, they last for quite some time. And on the bottom, you see the graph, how many patients have how much improvement. And you see 10% of the patients have huge improvements, 25 in between, and 50 also some improvements, and then the other 25 have little or no improvements. Could we have the next slide, please? So what does it depend on? I don't have much time, but I can tell you already that one of the most important factors we recently discovered is the patient's personality. Patients that are anxious, patients that are nervous, patients that have a high neurotic score, they benefit the most. Why? Because they have a vascular problem of this vascular supply to the eye and vascular supply to the brain. And therefore, they have a lot of neurons that are silent and sleeping, but not dead. So those are the patients that can be helped the most because they have most improvement potential, because the mechanism is a lack of neuronal activation and a vascular supply. So we find significant correlations between factors such as openness, such as conscientiousness, extroversion, and also neuroticism. So when patients come to you in the clinic and you find that they are quite nervous, next slide, you may say to them, and they have a vision loss, the ophthalmologist might say, well, you will go blind, or get used to going blind, come back regularly, and so on. That in turn is of course stress for the patient. So here you have a patient who is afraid, with anxiety, and then they hear you will go blind or you will stay blind forever. But the fact is that the patients may not completely go blind. We have a lot to offer in ophthalmology, and different influences can actually benefit the patient, such as issues related to stress. So when I was in India a few years ago, I asked the Ayurveda doctor, which is kind of the Indian version of the traditional Chinese medicine, what are the causes of vision loss? So he gave me a reference that is 3,000 years old. And of the 18 causes of vision loss, 1/3, that is 8 out of 18, were related to emotional states, to the grief, to anxiety, to stress, anger, and fear. Next. So we introduced a meditation program for our patients and asked them for 3 weeks to daily meditate with a simple breathing exercise. And what we found is that the ocular pressure, the intraocular pressure in the control group stayed the same, which is the black bar on the upper left. But in the meditation group, the intraocular pressure reduced significantly, which was associated with changes in oxidative stress, in cortisol levels, which is a stress hormone, but it had a beneficial effect on brain-derived neurotrophic factors, endorphins, and quality of life with a simple relaxation exercise. So what that shows us, next slide, is that there is a tight interaction between the stress out there in the world, they call it stressor, the actual inducing stimulus, the personality that it meets, and then the response on an emotional level, on the cellular level, and on the eye and pathology level. And if you then if we then tell our patients, you will go blind, it makes more stress, so it becomes a vicious cycle. More stress, more damage, more fear. So I want to finish up by indicating that with the therapy we offer in Germany, we introduce all these different techniques to our patients at the same time. So not one mechanism, but many mechanisms that you can read here. So the problem of vision loss is holistic. It is not only a matter of single molecules. And with that, I'd like to end by saying that we need to look at science, but also at traditional concepts of medicine, also in ophthalmology, because only both of them combined will give us the best opportunities for neuronal regeneration and recovery. Thank you very much.